Good day, everyone. My name is Robert Blake, and I'm here to talk to you about an important challenge faced by administrators in the healthcare industry today and into the future. If I was looking to put a title to this, I think it would have to be Modern Healthcare Administrators: How to be Compliant, Accountable, and Still Retain Humanity. Now, the main question here is, how does the modern healthcare administrator balance the humanistic side of healthcare while still responding to the boundaries of legal accountability in the areas of information technology, healthcare law, and human resource legislation? Now, basically, this is a question and presentation about administrative ethics. Okay, so what are professional ethics? The modern view of ethics is choosing right over wrong whenever a moral dilemma presents itself. But we must all remember, the general public views healthcare providers, doctors, administrators, nurses, and such, as representing the very epitome of ethical behavior at all times. Unfortunately, we all know that there is much more to it than just perceptions, right? I mean, let's consider the challenges to healthcare administrators today. In a society that has set formal laws and regulations telling them exactly how to act ethically in almost any given situation, how are they supposed to know that there is just way too many twists and turns out there when dealing with patients, family, and staff? This begs the moral question: do they really have a right to make their own ethical choices? The answer is, well, most definitely. Now, look, laws, rules, and regulations only set the parameters we as directors act within. The individual administrator decides how they will individually respond ethically within those mandated guidelines. Now, that's a little confusing, right? Well, when we're confused, it's always best to start from the beginning. Okay, let's recall the three basic assumptions about medical ethics. We, as healthcare professionals, we ensure compliance and accountability to everybody, but in the most humane way within our given boundaries. Here's a better way to look at this. Consider the challenge here like a battle. In this case, the uphill battle to achieve the acceptable balance between compliance, accountability, and humanity. Now, this battle can only be won by understanding the influences and the barriers that govern the ethical choices that we make. Know your friends and your enemies, your strengths, your weaknesses, and all the resources that are at play. Let's examine the three primary issues that most affect us, shall we? The three areas of concern are advances in information technology, constraints of evolving healthcare law, and human resource rights and initiatives, which concern the staff that we direct. Now, as we examine each one of these in turn, I would like you to please note there's an underlying ethical dependency that each has on the other. They all influence each other. I mean, they're obviously intertwined, right? Okay, so information technology. We all know it affects everything we do nowadays. But the greatest advances in information technology affecting modern healthcare in the new millennium are in the way we rely on and communicate at work, and in our methods of electronic healthcare recording. Let's take a quick look at some of these advances. In communications, we have internal and external contact between administrators, patients, departments, and staff. Also, think about how we can now send, receive, and record patient information instantaneously in medical health records. There's where the second part comes in medical records and diagnosis. We've got patient history, diagnosis, and treatment all recorded in real time. And let's not overlook electronic medical coding and billing. That's where IT has really had its explosions. Really, folks, how can something so positive possibly create an ethical dilemma? Well, how about some quick real-world examples to make that a little clearer? Imagine just what could go wrong in any one of these following situations. The inadvertent recording of patient descriptions, misidentified as potentially suicidal, misreporting of suspected abuse of persons through statements made under stress, emotional outbursts that can be misrepresented during the end-of-life issues, inaccuracies in patient incident reports, misguided recording of situations meeting mandatory recording requirements, any staff mistakes that are incorrectly put into their permanent files and follow them forever, numerical mistakes that result in medication errors. This is a major concern. Inadvertently recording sensitive information in discoverable data files. This is a society of litigation, no doubt. and intrusions by unauthorized users of government interventions of our protected data. Now, we've all heard it, right? A computer never lies. Not true. Information technology is only as accurate as the policies and procedures that guide it. It doesn't know right from wrong. Immediately, most of us think of HIPAA, right? The Health Information Portability and Accounting Act. Now, HIPAA is great, but the actual procedures and guidelines of staffs fall to the healthcare administrator to ensure compliance and accountability. It is through the administrators that direct influence and humanistic qualities are defined. Whether the upper or lower boundaries are applied case by case or as a general rule of thumb, in an ethical decision they make according to their own personal moral fiber, weighed against economic, social, and legal considerations. That brings us to the second dimension, healthcare law. Now realize this, legislated healthcare law does not keep pace with the speed of modern medical advances. The fear of litigation this causes has created an aura of defensive medicine throughout the entire industry. We see this evidenced by the cries for tort reform nationwide. It really is common knowledge that the threat of malpractice and negligence is rampant in American sue-happy society and culture. Administrators must consider possible punishment arising from these things such as malpractice, emergency medicine, end-of-life issues, insurance scams, professional misconduct, and negligence. Anything they do and influence ethical decisions and that they exert, they have to be accountable for. These concerns are compelling administrators to comply just with baseline legislated ethics without reflecting themselves or the moral philosophy of the populations that they're obligated to serve. After all, legally set ethical boundaries is what society demands of its government. And in response, professional associations, universities, and politicians across the nation have exerted pressure upon the legal system to officially set and enforce these ideas of an upper and lower moral boundary. What is their focus? Well, it's up to the administrator to keep abreast of all these laws, changes, and trends to be able to adhere to the requirements of modern healthcare law, the economics involved, and all the possible social and legal ramifications. But still, they have to be humane and realistic in their approach. In this, knowledge is power. Here for the modern administrator to be ethically effective and to stay within legal parameters. And finally, human resources. I've always followed a healthy mix in all things. That's always sound advice, don't you agree? Now, what do I mean here? A good ethics-based administrator knows and respects their people and supports their efforts to get that same respect in return. Just like in modern healthcare law, human resource legislation provides basic minimum protections for the workforce. These, again, are just basics. And how beneficent, empathetic, fair, or just an administrator interacts with their own staff is what directly reflects the moral philosophy of the administrator themselves and what they truly embrace. One more time, let's take a quick look at some of these basic laws that administrators get judged by. We've got here the Civil Rights Act of 1964, Age Discrimination in Employment Act, Americans with Disabilities Act, the Fair Labor Standards Act, Rehabilitation Act of 1973, all the affirmative action initiatives, the Family and Medical Leave Act, the Privacy Act of 1974, the Electronic Privacy Communications Act after that in 1986, and the Occupational Safety and Health Act. Let us not forget the ultimate, though, of Health Information Portability and Accountability Act, HIPAA. Now let's summarize these ethical concerns and influences. Administrators are the ones challenged to protect the economic, social, moral, and legal interests of their stakeholders, patients, and the public that they serve. Now they've got boundaries that they operate within, and these are all influenced by, number one, modern information technology and its innovations. Two, overcoming the posturing of the defensive medicine from healthcare laws. And number three, the fair and just treatment of their staff without falling below minimum standards or fair dealing or social justice. And of course, there is much more to this complicated balancing act that compels each administrator to make his choice than we could possibly address, given these time limitations. So their choices must equate to more than just strict adherence to minimum performance. The administrator's very career profile is expected to encompass the very, very best qualities of managers in the world of business today. And it is through their actions and influences on committees, boards, and in their personal relationships that they make, that the very best use of their existing mechanisms that they have at their disposal to provide the best possible outcome for all in the patient-provider relationship. So, does this signify the end, or is it just the beginning? Ultimately, the ethics-based administrator's success is measured in fewer malpractice claims, reduced risk and liability to their institution, positive feedback from those they serve, the perception of a just corporate climate, reduced political barriers, increased community involvement, and finally, positive regulatory evaluations. I mean, if you take nothing away from this today, let it be this one thing. Administrative success today will lead to a more compassionate tomorrow. I'd like to thank you for your time today, and I've really enjoyed our class together. Thank you very much.